We have a special guest, a dear friend, very successful lady, very intelligent lady, I would say, very a great leader, natural leader, somebody that I learned to admire. We've been working together, collaborating for a while. She is a DSD clinic as well, part of our DSD network. She has an amazing concept that I think will be the main story of today, a main concept that she developed, that she started, that she pioneered. She calls it wellness dentistry. It's a philosophy that she uses that helped her develop an amazing type of treatment that goes beyond just regular dentistry, but also allowed her to develop an amazing business. So I think that her story can inspire all of us and help many people, many doctors to open their eyes to this new world of treating patients beyond their teeth, treating patients beyond normal dentistry. So, welcome, Katie. Thanks for joining. And yes, I'm going to start with my first question. What is wellness dentistry?
Thank you, Dr. Coachman, and thank you, Kurt. It's truly my honor to be here and be the first one of 2024 in
Mhm.
January talking about wellness. Wow, what a perfect topic. Answer the question of what is wellness dentistry. I get asked that a lot, and I do have to explain that to patient as well. Because when patient coming in, they was looking for different names. For example, holistic dentistry, biological dentistry, functional dentistry, systemic dentistry. To patient, it means you're more than just a dentist. You are connecting the mouth and the rest of the body. For me, the wellness dentistry, my definition in my practice, we have it on the wall, we have it on a website. It is a confident smile for healthy life. You cannot smile when you're sick and don't want to get out of bed, or you have chronic fatigue and autoimmune issues and all this chronic inflammations, conditions. But also, if you're healthy, but you don't have a healthy smile or a confident smile, you're going hiding your smile in your selfie, not showing your smile or true self to the world. So for us in our practice as a dentist, we define wellness dentistry as confident smile for healthy life.
That's a great definition. I would say is the opposite of what I call camouflage dentistry, right? Camouflage dentistry is a topic that I've been talking. Initially, I started to use this term to explain not taking in consideration airway, for example, that became a big topic in dentistry, and it should be a big topic in dentistry. But wellness, just the word itself, says it all. It's beyond anything. As you said, you mentioned many terms. Wellness. I love the term wellness to explain what you do. Um, so, why this is so important for the patient? Why patients should look for a wellness dentist?
Absolutely. Actually, patient, even when they come in, they know this is what something more than their regular dentist provide. But when they realize that wellness dentists collaborate with other healthcare professional, so we don't just treat teeth or gum, we're actually treating
Mhm.
the mouth, which is beginning of our gut system. The mouth where it's about 3 inches from the brain, the mouth where a lot of our functioning, I would say nutrition, communication, airway, breathing, all of that start from the mouth. So, and the good thing about the dentist is we have accessibility to the mouth versus the GI specialists who have to get the scope down and have to doing all kind of prescriptions to get there. So patient, when they come to us, they know we collaborate with medical professional. So we actually working with a physician, with naturopath, chiropractor, the nurse practitioner, so nutritionist, everyone that have a part of that team. So wellness dentistry is just like you are practicing solo. You see the patient, you have no idea what their blood work look like. You don't know who they collaborating with or who's taking care of them. Is really bring the team together, and that's what make the difference. I'm not the solo practitioners on that patient health journey. I'm always knowing who's treating them, what are they doing, and we are not ruling out the energy spiritual provider also, because
Mhm.
we have three bodies within us. We have the physical body, which is, as a dentist, we can help with teeth, gum, bite, airway, and all that, but that's physical body. We also have the emotional body. I can tell from my new patient visit which patient will recover and doing well if they have a healthy emotional body. And then the last body is the spiritual body. If they really believe that they're going to get well, they having a faith, they having the purpose and the optimism, they also recover better than the patient that didn't have that.
Mm-hmm.
So being a wellness dentist, you have to be aware of the patient coming in, have
Mm-hmm.
those collaborations. They had to have the team together. If not, we can connect the team together for them. And they also have to work on the three bodies. And
Mm-hmm.
that's a reminder, because a lot of time you're helping patients to get cavities, fighting cavities, for example, and you said, how come they floss? How come they brush? But they still have cavities. Well, if they are negative persons or they have a lot of anxiety or anger issues, their body itself become acidic. You cannot give them enough things in the mouth, toothpaste, rinse, or MI paste, anything to reverse that when the saliva is acidic 24/7.
Yeah.
So have
This is
that understanding, really put the ownership of their health on the patient, and we truly become the guide and they are the hero of the journey.
Yeah. Katie, this is an amazing perspective. Very rarely do we find someone that has such a well-rounded perspective. I would love to know where this all started. And I think part of your journey, like, you didn't just think of this. There are things I'd love to hear your story and share your story and how this came about.
Yes, I remember when Dr. Coachman asked me to share this journey in one of our DSC residency. There's a quote that things happen for you and not to you. And to this day, I reflecting, every decade of our life, what happened for us. But at that time, we think it's happened to us. And so 6 years ago, I thought it's happened to me when I got really sick. And all the doctor that I see in that point would say, Katie, you're healthy. You're just a new mom. You're having a business. You're just stressed. They basically downplay your symptom and not really get to know you and get to know more than just the blood work. Then I really open and share that with my patients, who pointed out to his functional doctor and say, Dr. Katie, go check out this functional doctor because they look beyond just the regular blood work. And when I go, it's just like Dr. Coachman said about first patient experience, first appointment. I have 2 hours with the doctor, an hour with nutritionist. And I said, oh my gosh, nobody ever asked how I was born. Is it C-sections or is vaginal birth? I'm like, why is matter? Well, it's really a big deal, right? Tongue tie, sugars are not sugar, dairies are not dairy. And it just opened the world of what are we missing in dental practices when we have the opportunity to address that. Go back to my story. I see the functional doctor. After asking what my occupation is and find out I work in dentistry, they order a heavy metal panel as well as all the different toxic metal like mold, parasite. My heavy metal come back really, really bad, which is beyond any limit of EPA or CDC even consider safe. And that's when I was like, what is going on? And of course, I was not believing that result. I go to 2 more doctors and the result come the same. You have heavy metal toxicity, it driven your autoimmune system really in chaos. And so you don't know what is friends or foe. And so even lettuce and tomato and cucumbers and things that healthy for you, I'm allergic to at that point. My body respond as an allergic reaction. And so the question is, if dentistry that toxic to me, can I still practicing? Is this happening to anyone else or just me? Is this happening to me? Well, that's really changed when I realized that, well, all of us have different DNA. My husband also in dentistry, he also have metal in his mouth, but he didn't have that problem. I have it because that's my DNA, but it's also I have it because I didn't know how to take care of my body based on the DNA or based on my occupation. So going through healing process of calming down that immune system, learning about nutrition, hydration, learning about it's not just physical body, Katie, it's also emotional. Yes, you stress. That's why your body is also more inflamed. Yes, you need to believe that you can get well, otherwise it's not going to work. So when I learned going through that journey, I learned about that 3 bodies, about meditation, about journaling, about getting better is not just all about physical. And when I come back to my practice, I transform the practice into biological wellness, holistic dentistry. And since my team saw my suffering throughout that year, they get on board because they know if that's happened to Dr. Katie, it could happen to me. It could happen to the patient. So therefore, we walk the talk. We also work on our health. When we tell patients to tape their mouth so they can breathe through their nose, we have a picture of ourselves taping our mouth at night. So you walk the talk and not just lecturing and not just giving them information and not no connection. So I can tell it started from a self-care perspective, and I'm bringing what I'm experiencing in my life into my practice, and really that connect with the patient.
And
That's connect with the patient. Yes.
everything you're saying really is so obvious. And why do you think something so obvious is so rare? Why do you think we are all so blind to see beyond, that traditional view of dentistry?
I do believe, and I'm very optimistic, and I consider that my superpower, is we all know there's more than just dentistry in the mouth for the patient and for us, but we don't know how. There's no one showing us the way. There's no one sharing what they're doing and what's working. So therefore, we're thinking, if the dental school didn't teach us, this might not be true. If they didn't teach digital smile design, I don't think digital smile design going to work. That's the mentality. If no one else before us teach us or sharing, and we don't know what that is, we try not to implement it because we don't know how to implement it. And I think that's the reason, and that's encouraging me. I would say a lot of my courage sharing my story on stage and to the social, but then also I know someone else listened to me. I got a lot of people message me after and say, Katie, I have that issue too. I didn't know it's a heavy metal. Oh, I didn't know it's mold. I didn't know it's parasite. Thank God that you talk about it openly.
So that's why it's so important, the movement that you are starting, or that you're one of the main promoters, of all these concepts of exploring beyond the obvious, and bringing all these pieces together, because patients can see the difference and they value the difference. So it's a beautiful combination of a concept that allows you to deliver better care, but also have a better business. Today, of course, you have a very strong name in this environment, and word of mouth is very big. And I know that your practice is running 100% on wellness dentistry. It was not like that ever, at the beginning. It was not always like that. Today, most of your patients, they come because you do wellness dentistry, or they come and they are surprised that you do wellness dentistry.
I love your questions because a lot of people assume that, oh, because Katie do wellness, so everyone come to Katie, know what wellness is. Well, a lot of majority of my patients today are medical referral. So they're coming from medical offices or a healthcare professional that I'm collaborating or working with, or a lot of healthcare professional heard of me from the podcast or some articles or from their circle, and they refer patient to us because they couldn't find anyone else that they know of or in the area that doing wellness dentistry. So I would say that is my blue ocean. However, when I started this journey back in 2018, the patient that I have this conversation with is my existing patient. I telling them my story. I actually take picture of my face when I was swollen, my body when I was suffering. And I telling them this is what happened to me and I would not want to happen to you. And so my patient in my existing practice, the one that open and accept, well, a lot of them, when we go full force wellness and they're like, no, I don't want that, they laugh. And guess what? When they get sick and their doctor say, you need to see Dr. Katie, they come back, but they have to get in line. Now we're having 5 months wait list for new patient. We fee for service 100%. We are medical based, mostly referral. However, I want to remind dentists that listening, you all start from somewhere. So 2018, I was starting with just make sure I remove metals safely. I could not breathe those in the aerosol. And because of that, in 2020, I have all the equipment protect myself and my team against COVID. We already wear the respirator when nobody know what N95 is before COVID. So things really happened for us. We will be able to helping patient that the hospital could not see during COVID because we have all the hospital equipment. We have surgical clean air in the office. So we start out with what we know, which is let's not getting metal in our system. Then we're implementing ozone. Then we're implementing medical procedure like getting blood work done, checking vitamin D before we're taking a tooth out to know the patient can heal properly. So I would say no. When we start this journey, the patient that we have the conversation is our existing patient. Today in 2024, our patients are coming from medical referral. And our medical professional doesn't look at us as, you're just a dentist. They're actually asking us before we move on to the gut health and the hormone health, can you please make sure the patient oral cavity are clear? We actually require medical clearance before patient can move on with oncology treatment and even major surgery because doctor understand the importance of the oral health.
So you're creating an amazing network between dentists and physicians, to really look at the patient together. It's again so obvious, so obvious, and so rare, right? It's a
Yeah.
blue ocean, as you said. You mentioned it. Conceptually and business wise, it's a blue ocean type of philosophy, and I know patients are blown away. And word of mouth is probably growing. People start to come from out of state. I know they're coming for you, and it shows that we need many, many more people embracing this type of care, right?
Yes. And you know what, Coachman, that Christian, you mentioned something really interesting. Because we practice wellness, we attract patients that also have very good understanding of their body and their health. And they
Mm-hmm.
also take responsibility for it. They're never going to come in and say, your crown come off. They're not going to say, oh, the filling you did, fell. They know, oh, Dr. Katie, I have not been drinking water the way I should. I didn't wear my appliance the way I should. They do take responsibility. And because of that, you actually feel the appreciation and you feel that this is your calling, your service, versus feeling you being blamed for everything going wrong in their mouth.
Mm-hmm.
Even though,
Yep.
airway is an issue, their
Mm-hmm.
job is killing them.
Yep.
Or their marriage is killing them. It's not your fault.
Yeah.
So wellness dentistry patients are better patients just because
Better patient.
it's a journey, it's a partnership, it's a collaboration, it's a long-term
Yes.
partnership, right? We want to be together forever as healthcare providers and patients. We want them to be with us forever. It's a long-term vision. We are looking into the future and not looking into 10 veneers, right? We are looking into the future and not looking into aligning the lower teeth or fixing some old restorations. It's just a beautiful way. I can only also see how much this whole journey has made you happier as a professional,
Yes.
working with more pride, working with more pleasure, because you're doing something more special, even more special.
Yes. And I would say, besides having better patient who take care of themselves and invest in their health, they're willing to pay. Because people
Mhm.
always said, Katie, like how you are charging that much for an extraction and people lining up your schedule and paying for that. But you also cultivate amazing team that also believe in your philosophy,
Mhm.
walking the talk,
Mhm.
right? They are extensions of my service and my vision. And
Yep.
so you have less turnover. I know the last 4 years, every dentist talking about team turnover. Katie, how
Mhm.
do I get a team? How do I get my, vision when I don't
Motivation.
have a team? Yes, they're struggling. And I see that and I understand that. But when you cultivate the team that they know, I have my physical body, I need to control my emotional body, and I'm actually serving my calling and my service here at the practice, they're
Mhm.
not leaving you.
It's a philosophy, it's a way of treating people that really makes everybody proud
Yes.
and the staff. I can only imagine the comparison between working in a nice but normal dental practice, like many dental practices. If you have a little opportunity that is slightly better, you're going to move like this, right?
Mhm.
If there's a stressful day or something like that, you just, there's nothing ultra special about working in an environment like this. Dental practice is only a dental practice, but in a place like this, where you're profoundly changing people's lives and you see the results and you see patients coming back like magic, like this is magical, what you guys are
Yeah.
doing. uh, uh, and I can only see the staff. I can only imagine the staff saying, I love this place. I feel so good about it. I feel so useful. The purpose is so clear that for me to go somewhere else and work somewhere else, something really, really very big has to happen. So when every or a huge majority of practitioners are suffering with staff, and we hear that, as you mentioned, everybody's complaining. I cannot find people. When I train them, they leave. I cannot keep the good people. People don't want to work hard anymore. People don't want to stay, blah, 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 blah. When you have a type of philosophy like this, it's almost like a recipe to solve these problems.
Yes. And we not only working in our practice, we don't providing healthcare. We are very, compared to a lot of practice, the big practice in United States, we have 10 team members. And what we telling them, we provide them physical wellness, which means we make sure that they have their checkup, the blood work. Our referral doctor actually helping us with taking care of our team, because we are a team, a bigger team. And then we also helping them with emotional wellness. We have therapists come in and talk to them about how to get their emotion, how to handle that. So you equip your team with those skills. And then we're also having financial wellness. Well, the reason they're asking for $1 more here and there is because they don't really have a budget or know how to handle their money. The moment they having the control of their money, guess what? They would no longer blame you when they run out of money because they spend too much money on Starbucks. In order to keep a team, is more than just physical wellness. You got to have them, provide them the opportunity, the environment to grow. And guess what? In return, you don't have turnover. You have a high level. And if you're reading our 500 plus review on Google, people always talk about my team, and I'm so proud of that. I don't want people just braving about me. But I want them to talk about my team, and that's exactly, they always said my team is an extension of me. That's why they love coming to the practice, because of the team. And I'm really, truly blessed on that.
Christian and I have done a lot of podcasts. I mean, we're talking hundreds of podcasts. No one's ever shared anything that thoughtful about the people they employ. I mean, get their blood work done, emotional wellness, financial wellness. I think your story is powerful. How you care about your team is powerful. There's always two pieces of courage. It's the courage to learn something like you're going through DSD, but the courage to do something about it. We have a lot of young listeners, a lot of young dentists, Katie. And what's really cool is you've taken this thing that's a calling for you and you've made it a business model. What would you say to a young dentist who's listening to this going, I would love to do that, but, I can't. What would you say?
Oh, you can do it today, because the wellness dentistry exam, as I share with Dr. Coachman, is starting with you get to know the patient and not just go through the motion of checking their teeth, their bite, right, their gum, but really knowing if you see something, ask questions. Ask questions why this happened, get to know them, curious about them. And even just airway, you don't have to, I love this Dr. Coachman talk about, and I share with my patient all the time. You can have to be identifier, then evaluator, then stabilizer, then healer. You don't have to be the healer today. You still have a lot to learn. You can learn to be identifier and evaluator. And just listen to the podcast like this, or joining study clubs, or getting some coaching, get you started. You can do it yourself, or you can get some hand holding, but don't just sit there and wish. You got to put in the work.
She's being very nice here, not to mention that she has an amazing course of herself. She teaches this. So it's very, very easy for all the youngsters listening to us. Google Katie Toe or find their website, Wellness Dentistry, and do her course. Very simple. Join her network, join her movement, her group. That's a great way to start. But I think you mentioned something very important. One thing that needs to change on the mindset of young dentists is the exploration of the patient at the beginning. The way we listen, the way we are open to things beyond the obvious that we learn in dental school. It's the simple concept to accept that we don't know what we don't know, and there's so much we don't know. And even if we are 50 years doing dentistry and we are the best dentists in the world, there's still so much we don't know. We just don't know. And just this beginner's mind and this openness to explore, beyond the obvious, and listen to the patient and try to connect with other doctors, right? Try to connect to other specialists. Become an identifier means that you know just enough of everything that you don't know. You know just enough of everything you don't know to raise the yellow flag and say, maybe there's something here. And then you will find the people that will help you explore that, and deep dive into certain issues. And as you start to reach out, you start to incorporate this into your examination, and your first appointment, step by step, start to become a wellness dentistry first appointment. Just give us some insights about things that you do today on your first and second appointment that you didn't do in the past. That a very good dentist doesn't do this, right? What are the main things that differentiate a wellness dentist in this initial process with the patient?
Yes, so I know a lot of airway dentists, restorative dentists focus on one area, but as wellness dentists, we're going to tie everything together. So our exam is a first visit. We always look at their posture. And I think you have been
Fantastic.
lecturing about it a lot. Chirodontic, the head and the body. While you cannot just treat the joint here independently, is connected the rest of the body to the posture, to the tongue tie, to all that. So our visit, the patient was like, I have no dentist ask me ever get out of the chair to look at where my shoulder is. So you got to have to look at the patient when they're standing up. You can do that before they sit down. You can do that during. I also look at their neck with the teeth together or teeth apart. Because if it's teeth together and the neck is so restricted, that means during the day, when they swallow 2,000 times a day, they always in that restriction. But if I put in a wooden tongue depressor between the teeth, and now having them tilt the head, which means C1, 2, and 3 evaluation, and I can see they have much more range of motion, I can have a conversation about moving teeth. So now they don't get into that locking position when the teeth come together. So just like Dr. Coachman said, a lot of our patients come in for wellness, they walk away, understand their body, they walk away, understand I need ortho. They don't want to asking for it, not me. They don't want to know, oh, I need a design because my teeth are not in the right place. But before I'm going to ortho, I want to know what the end in mind. They also do less dentistry because what they're doing lasts longer and stabilize longer. And so that's come with our wellness dentistry philosophy that I came from my own practice. Is number one, it's a personal journey. If Kurt comes to my practice or Dr. Coachman comes to my practice, you all coming out with a personalized treatment plan, homework, the next step, the next collaboration, like who you see in our network that will fit into your life right now. If Dr. Coachman have a little bit of a neck issue, you're going to go see my chiropractor I refer. Kurt, if you have an issue with the tongue and that causing your tensions in your neck and your shoulder and your lower back, you're going to see my myofunctional therapist. So personalized patient, personalized treatment. Number two, you have to own your journey. You're the hero, I'm your guy. And so they do the homework. And that's the reason why our number two difference in my exam is we always give patient homework. Homework means you do at home. It means we're going to check on it. I mean, if you're not doing your homework, we're not going to give you more things to do because that's just going to lead to more disappointment. Sometimes self-resentment that they like, I buy all this, I pay for all this supplements or all this thing, and I don't get better. And then, of course, the last thing, less is more. Less is more. Less dentistry will keep more teeth, right? Less, I would say, inflammation, you get healthier. But it doesn't mean that we don't do dentistry at all. It means that patient understand in order to get to wellness, it's not single tooth dentistry anymore. We look at every single tooth, we look at every single factor, and we come with a treatment plan that have a long-lasting result. So for me, it's really, I would say, a great pleasure. And just like Dr. Coachman said, it's a calling. When I go to work, I was like, who can I help today? What story would I discover today? Just right before Christmas, we have a patient calling and say, I saw you 2 years ago. You told me about this tooth that have infection, and I didn't do anything, and my vision kept getting worse. And when she said, I would like to get this infection taken care of, we remove the tooth, do PRF, laser, ozone, and all the biomodulations, and I would say vitamin C treatment and all that. She's coming back with her optometrist. The first week that we opened after New Year, she came in for her post-op visit with her optometrist. And I'm like, oh, hi. I have not met the optometrist before. And she said, my optometrist has been taking care of me for 3 years. When I saw you 2 years ago, my vision did get worse, but the last 2 years got significantly worse. But after I got my infections out, I came back in because my vision get clear. My optometrist want to know, who am I seeing as a dentist? I can tell you this story that we hear. I got goosebumps still. I cannot reproduce or promise this result to any patient because it's a personalized journey. But our team witnessed that. And for me, that's the biggest currency, more than money, more than fame, more than Google review, is about changing someone's life, especially vision. I mean, who could think a dentist taking out an infection, which is, I think, a lot of dentists doing it every day. But because we don't connect and really understand the patient, even though you achieve the result, patient doesn't give you the connection and the credit for it.
Yeah.
They don't.
Yep. Yeah.
So many of us removing infection for patient and help them from the brain trauma, right? And Alzheimer potential of all this disease, but we don't have that connection to really educate patient to recognize the difference.
You know, Katie, I just got to say this because when we were talking, Christian and I treatment plan our episodes. We think about who we're, and he's like, we have to get Katie on the show. And I said, he said, she's an amazing Rex. I have 2 pages of notes. I have so many questions. Like, I'm going to quote you on this one. The patients are the hero in this journey. I'm just the guide.
The other good one is going to the practice in the morning and asking yourself, what beautiful story I'm going to learn today. That's a good one.
Absolutely. Absolutely.
That's a positive mindset.
Yeah, we got to have her back again and again. And Christian, I want both of you to give us some final thoughts on this. And then after we do, Katie, I want you to talk about your courses and where, if somebody's listening, how they can find out. But who wants to go first?
So I know that people said, Katie, you got this success, you got this joy. I can see how happy you are. And I said, you know, when I start out this journey, it's all about self-care. I would worry about myself. I don't want to give up dentistry. I love dentistry and I don't want to give up because of my health. But now when I realize that what I can do for patient and how I learn every day from who they're seeing, what they're doing, what's working and what not, I just feel like the gift that keep on giving. So when you start this journey, you think you're helping patient, or you think I'm gonna helping my practice to be able to go to the next level, or I'm helping patient. No, you're actually helping yourself and your family. My children's are the healthiest than ever. My husband benefit from it. My parents have benefit from it. My team benefit from it. So when you start a journey, you think it is for someone else or for your practice, but it's actually for yourself. So it's a journey to discover yourself and really find dentistry as a calling. It's no longer the pressure of, can I pay my bill this month? Can I hire the right people for the team? It's really about discovering that journey and follow the calling. Because if it's a calling, you're going to do it just like motherhood. It's not easy. But because I know it's calling that an answer, and I was given these beautiful children, I'm going to do whatever it takes to take care of it and to grow and to thrive. And the same with dentistry. You've got to look at dentistry as a calling, because if not, you're going to give up. You're going to blame everyone else except yourself, and you're not going to be happy. So yes, we want to be the best, better than who we are yesterday, but I also want to be the happiest. So you can do both.
Christian, you give us some final words.
Yes.
Yeah, I just hope that more and more people will learn from Katie and others with that same mentality. Learn from mentors, like this and expand their horizons. There's so much out there to learn, and patients are in need. Patients are valuing it. And dentistry is a very tough profession. We know that.
Mhm.
And finding a deeper purpose is the best way to transform a stressful profession into the best profession ever.
So well said, both of you. Now, Katie, this is my first time meeting you. And I know there's a lot of people listening. This is their first time. How do I find out more about you? Tell us about your courses. And did you mention podcasts? Do you have a podcast too, or what do you do?
Yes, everything wellness. If you Google wellness dentist, wellness dentistry, that's us. So we have a podcast called The Wellness Dentist. And we also invite providers, inpatient telling the story, success story, so you can hear from them and not just me. Like the patient at the eye store, she's going to go on our podcast and share her story. So the Wellness Podcast, we also have an institute for wellness dentists called Wellness Dentist Institute. And of course, my social media, Dr. Katie Toe, you can DM, you can follow. I'm truly practice what I'm preaching, and I learn from the best of the best. And I'm so honored to be on the podcast today.
Well, we are too. I'm a big fan now. Stick around, both of you, while we say goodbye to everybody else. But hey, if you're listening to this, I hope you enjoyed this as much as I did.